about to experience Healthline, a show where doctors from Makati Med interact with you for a healthy, uplifting lifestyle, moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, welcome to Healthline with Makati Med. I'm your host, Nicole Jacinto, and we are live on DZRJ 8:10 a.m. Radio Bandido, and we are also live on DZRJ 8:10 a.m. Radio Bandido TV. We're live on Facebook. We are on YouTube and other streaming platforms as well. And today on the show, so thanks for listening and viewing on all those platforms, and please view again and again and again and again if you'd like, because there is a lot that we can learn. And especially for today, we are going to talk about coronary artery disease, or CAD. And with us, we have Dr. 𝗛𝗸𝗁 of Makati Medical Center, of course, and he's a cardiology specialist. Thank you for joining us. Welcome, Dr. De La Rosa.
Thank you, Nicole. Nice to be back.
Yes. Okay. So
yeah, I remember a few years ago I was here also.
yes, I know. At the time we were talking live. No, we were in the studio.
Yeah,
Thank you.
correct.
Yeah, thank you for joining us and zooming in. After with all the technology these days, I'm thankful that we can do this. And thank you for joining us again. I've been actually looking forward to seeing some of our old guests and old faces, and I'm sure that you will give us just as much information today as you did that last time. It's always good to remind ourselves and other people about all of these health issues and conditions. So I'm happy you joined us today to talk about coronary artery disease. Okay, Dr. De La Rosa, can you tell us, what do I call it, CAD? Is that how you say it, or do we say CAD for short?
That's just the same. It means the same.
Okay.
So to make it short, you can call it CAD.
Okay. So Dr. De La Rosa, what exactly is coronary artery disease? And
okay. Yeah, coronary artery disease is a medical condition where the blood flow to the coronary arteries are impeded. So it means there's stenosis or a blockage. No? So this is usually brought about by atherosclerosis, or deposition of plaques or cholesterol plaques, and that impedes the blood flow. So you can think of it as a road. No?
yes.
If there's a narrowing, for example, there's a car that gets stalled and then the blood flows gets diminished. So the coronary arteries acts that way. So once you have diminished flow, then it affects the circulation to the heart.
Okay. Doctor, can you tell us the difference between arteries and veins, so that, because a lot of people will say ay ugat, and in Tagalog, ugat means both, I guess, arteries and veins. But perhaps if we know the difference between arteries and veins, and and after that, maybe like what parts of the body does coronary artery disease, or CAD, affect really?
Okay, when you talk about arteries, these are the blood vessels that flows from the heart to the circulation. And then when we talk about veins, we talk about the blood vessels wherein the blood flows from the peripheral areas to the heart to get oxygenated. So when we talk about coronary arteries, these are actually the blood vessels on top of the heart. And that's why it's called coronary. It's like a crown that that sits on top of the heart. And this is where the blood supply of the heart passes through. No? So that's a very important blood vessel, because without it, the heart will not survive.
Yeah, the heart will not survive without that. So it really mainly affects the heart. But as you said,
but the heart affects the whole body.
Yes. So it's basically the whole body. If you consider any of your other organs or system, whether it's your brain or even just your limbs, no, Doc? Your limbs,
yes, correct. That's correct.
Your arms, your stomach. So, and the heart is the one sending out. The arteries is the blood that carries the basically the heart pumps. Am I correct? Please jump in and correct me anytime. And
Yeah,
then
it carries the blood that supplies the heart, and then the heart is, as you know, is the pump that where the blood flows to the whole circulation. So basically, the heart will pump the oxygenated blood, and it goes to the head, to the limbs, to the abdominal areas, and the different organs of the body.
okay, thank you, Doc. Now, Doctor, can you tell us what the causes of coronary artery disease are, and also maybe the symptoms? Like, when should someone seek attention based on the symptoms they feel? Well, first the causes, no? So that, yeah.
So usually it's the buildup of cholesterol deposits at the surface of the blood vessels. So eventually, in time, there's narrowing, so the blood flow is diminished to the heart. No? And then the symptoms then will be commonly what we call as chest pain, and some people will have shortness of breathing, palpitations, and even loss of consciousness. But there are a number of coronary artery disease patients that will have what we call silent ischemia, wherein you can have diminished blood flow to the heart without any symptoms. And this is more common in patients who have diabetes.
Oh, okay. So basically, when the cause is really cholesterol plaque buildup.
Yes.
Okay. So
And then it has also some calcium deposits there and other waste products that the pipe eventually gets clogged, and then you have these symptoms like chest pain and shortness of breathing.
okay, and but you also said that it could just be like silent, as you said, and then suddenly the person will just lose consciousness, and that's when it's discovered. Okay, doctor, as for the relationship between cholesterol and coronary heart disease, how do we get cholesterol? How do we basically get cholesterol into our bodies?
It's basically the food that we eat, the food that we really love to eat. So these are the red meat, pork, beef, those fried foods, and especially the deep fried ones. No? So although some will be congenital, so even if they eat really good food, because of their genes, they tend to have higher cholesterol. That is what we call the familial hypercholesterolemia.
Okay. Doctor, when you say familial, that means, and of course the genes, so it runs in the family.
Yeah,
And
even if you're good, your genes are not good. So
the genes are, yes. Could it be though, doctor, that let's say in one family, both parents don't have it, or their genes are good in the sense that, or it's not manifesting, no, getting high cholesterol, but one of the children or more of the children will have it? Is it that type of gene that gets inherited even from like forefathers or ancestors?
yes, it can be genetic, but more commonly, it's more of the food that we eat.
The food that we eat.
So
Okay.
the familial type is quite rare. So more often than not, these are the effect of the environment, like lack of exercise, and then if you're fond of eating pork, beef, and the fried foods, then we're prone to have this type of problem.
So how about like fish, doctor? You didn't mention fish or chicken. Those are not high in cholesterol? Or maybe we can circle back to this later.
Yeah, the fish is high in good cholesterol. So there are two types of cholesterol. There's the bad cholesterol and the good cholesterol. So usually the cholesterol from the fish is called the good cholesterol.
Yes. Okay, doctor. We can circle back to that later when I ask you for tips and talk more about good and bad cholesterol. But before we continue any further, we're just going to take a short break. And then, doctor, we'll be back. And guys, stay tuned because we're going to talk about how people like Dr. De La Rosa diagnose coronary heart disease, coronary artery disease, and all of these other things right when we get back from this short break. Stay tuned to Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Hi, everybody. Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We are here with Dr. 𝗛𝗶𝘶, who has been on this program before, and I'm so happy to have you back, Dr. 𝗛𝗶. And we're talking about coronary artery disease, or CAD. And Dr. 𝗛𝗶, before we went on break, we talked about the causes and the symptoms of CAD, and as you said, it's really the food we eat, because it's so much related to cholesterol and the buildup of plaque. You did say there were other buildups as well, like calcium and all that, but you said it's really a matter of diet most of the time, and it's rare that genetics can play a role in it, but it's rare that that happens. Can I ask you, doctor, how is coronary artery disease diagnosed for sure? Like with someone like you, let's say somebody experienced those symptoms, had chest pain, shortness of breath, lost consciousness, and they were brought to the ER, or one of your patients just went to you and said, I'm having these symptoms. How would you diagnose it? And what are the tests or procedures involved in diagnosing CAD?
Yeah, a basic thing that we have to do as doctors is to get a good history and physical examination. And then we do run tests to check for other risk factors. And that will include diabetes, so you check your sugar, we check the blood pressure, and sometimes hypertensive patients will not have symptoms at all. We check for what they call this, the lifestyle of the patients, their sleeping habits, their diet, whether they're sedentary or not, because all this will play a role in increasing the risk for coronary artery disease. When we talk about coronary artery disease, there are what we call non-modifiable and the modifiable. So non-modifiable meaning there's nothing really much we can do about it. Like, for example, the age. As we get older, the risk gets higher also. And sex, for the male population, will have a higher risk compared to women who are pre-menopause. But after menopause, the risk for women also gets higher. And also the family history. If you were born in a family with early coronary artery disease, meaning less than 55 for male and less than 65 for female, then you're also prone to have coronary artery disease. But for us, we focus more on what we can modify. So we check for hypertension, and sometimes people can have hypertension without them knowing it, because majority of hypertensive patients will not have symptoms. So they feel perfectly well, and that's where the danger comes, when you don't know it's there, but actually your blood pressure is already high. So when you have hypertension, the risk for stroke, the risk for heart attack is also higher. The other thing is that diabetes. So more often than not, you have a family history of diabetes. Although some will come without family history, maybe they didn't know, or maybe it's also because of their diet. And then, of course, the cholesterol. Patients with high cholesterol, more often than not, will really have no symptoms. So sometimes there are signs like cholesterol deposits near the eyes, etc. More often than not, it can come without symptoms. That is where the importance of having yourself checked. Because as you mentioned earlier, when is the best time to have yourself checked? Well, the best time really is before the onset of coronary artery disease, because you don't want to be playing catch up. Like, for example, you're first seen by the doctor when you have already a heart attack, and some patients will not make it to the first heart attack. So the goal is to catch them early, control the risk factors years ahead, so that the risk for having coronary artery disease or even stroke will be much less.
Doctor, okay, from the number of things that you told me, you mentioned a lot. The last thing, one of the latter things you mentioned was that most patients will not make it through the first heart attack. So, is this true? That why is that? Because we've been told over the years that if you're the age of the late 30s, and especially if you're a male, or we've heard of incidents, even younger people, and basically a lot of males like getting the first heart attack and not surviving it. Is it because they just didn't know, because they thought they were young and they didn't check, or is
let me correct you on that. The most patients who have a heart attack will actually make it, but there will be a few who will not make it to the first heart attack. And the demographics have changed for the past few decades. No? When I was still in training, it's like most patients who will have heart attack will be in their 50s and 60s. And now we see them even in their 30s. So I think because it's more of the lifestyle change, the habits, sedentary lifestyle, smoking, vaping, too much alcohol, lack of sleep, and even maybe the stress factors. No? So this all contribute to early coronary artery disease.
And then, doctor, sometimes we hear a lot of it. We hear a lot of incidents where someone is competing, let's say in triathlons or even Ironman. So you think oh, usually it's a male. This guy's really healthy, and how come he can compete? And he's competed before. He's done, he's been swimming, exercising, and all of that. And then you hear he has a heart attack. How does that usually come into focus when, let's say, all the examinations are done afterwards? Why does that happen? If it's how can that happen, or not what happen? Is it because
most of these athletes will have some tests. For example, if you're a marathon, usually they require some form of a clearance from your doctor if you're fit enough to compete. But some of these will have a congenital problem that they didn't know. When they're exposed to extremes, not everybody's body is built to run 42 kilometers in
then swim
one sitting.
Yeah.
So especially maybe they didn't train enough as one, they get dehydrated. So those are some factors. And also nowadays with COVID-19, some of these might have had COVID-19, and some of this could have developed myocarditis. and this make them prone to this type of problems. And some of these myocarditis in COVID-19 are undiagnosed.
Okay.
So they thought it was just a late 90 mild and know that your heart getting pain.
Yes, doctor.
There was a study that we did for cry and we looked at a lot of myocarditis.
Mhm. Yes, doctor. Okay. Thank you. And also thank you for reminding us, no, the public that a lot of us who have gotten COVID, sometimes when you're younger, I noticed a lot talking to people about people younger than me, they kind of, oh, I got COVID. I got it twice. I got it thrice. Sometimes it's almost a bragging, right? That they have. But as all of the whole medical community has warned us already, there may be complications afterwards. So we do need to get ourselves checked and not just take for granted that our health and the level it was at before getting COVID is still the same until now. Thank you, doctor. Doctor, okay, I still have questions from the last few things you mentioned. You said that you do have to, when you diagnose coronary artery disease, of course, there are tests and procedures, but the first thing is you have to interview the patient and find out, like, yes, you have to ask them stuff. Like, I always have to feel like I have to remind patients, like, when the doctor asks you, you should be honest and try to, answer with as much detail. I guess as a doctor, you'd appreciate that. Like, if you asked, let's say, a patient, how long do you sleep at night? What kind of food do you like to eat? It's not a judgment, no? You're just really asking them. Yes. Yeah, judgment. And then, or, maybe what kind of diet are you on? Because some patients might be on some like high protein, high fat diet, with all the different types of diets that people are on these days. And so it's really like being a detective doctor. At first, the interview is very important.
Yeah, that's very important. Before we send patients to the what we call a stress test, be it at ordinary treadmill stress test or stress echo or perfusion imaging, we do the history and physical examination first. And then for those patients, for some patients, coronary angiogram is done.
Okay.
If warranted, especially those with positive stress test results.
So, doctor, just to kind of round it all up, so that to remind ourselves, you did mention that you take the blood pressure, because some people don't even know that they have high blood pressure, and that's a factor in maybe a symptom of having coronary artery disease, no? And especially when people are younger, as you said, the demographics have changed below 55. And then you ask the family history. And then if people have diabetes, and sometimes, as you said, they might not even know that they have diabetes, no?
Correct.
When it comes also to, the cholesterol count.
Hello?
Most basic test check.
Sorry.
Okay, there we go.
Sorry. A little bit choppy.
Okay. So sorry, doctor. I got cut out for a while. I don't, would you mind repeating some of the things you said if you had started answering my questions already?
What was the question again? I think I missed that also.
Okay. The question I asked you was like, after interviewing the patient, doing a physical exam, what is the most basic test that you start with to diagnose coronary artery disease? Is it a blood test to check for
we do the ECG, and then we run some blood chemistries, and then sometimes we do a stress test depending on the assessment. And sometimes we do the stress test with imaging, that's a stress echo or nuclear imaging. And in some patients, especially those with positive stress tests, we do a coronary angiogram.
Okay. So I'll just run through the test, doctor, to I often like to explain on the show like some of the things, and please jump in and correct me anytime. Because people kind of get scared when they say, "Oh my God, what tests?"
Mhm.
So just to run through it, when you do the blood test first, doctor, there's fasting involved because you have to tell
Correct.
them. Okay. So that's when people tell you how to fast. How long should the fasting be usually? Is it 8 weeks?
We usually recommend 10 to 12 hours of fasting.
10 to 12 hours and no water also.
Sometimes we allow it, minimum amounts of water should be okay.
All right, okay. So that's when they get your blood, and then I guess it's a Chem 23 or Spec 23 that you
Yes.
order.
Yeah, that's the complete chemistries we do in Makati Men.
Among other things, it's up to you if you see other things or decide, no. And then in that blood test you can already start seeing if their sugar is high, if their
Correct.
cholesterol is high, the good and the bad cholesterol, which I'm going to ask you about in a minute. And
Mm-hmm.
then, or not a minute, but very soon. And then also after doing that, doctor, you okay, you mentioned there's also a stress test. um Having done one a few times before, you make someone walk on a treadmill, and
Yeah.
perhaps you interview them first, like depending on their strength, right, doc? I mean, and
Mm-hmm.
then there are really in Makati Med, there are really really reliable and knowledgeable technicians who help you out. So all you have to do is walk around on that, and they patch things up to your chest. It's not painful, and then they you can tell. And then as you said, sometimes you do that also. Sorry, the 2D echo, the ECG is where you just lie down and they put again like a bit of lotion and
Electrodes. Yeah.
on you. And then you can see how the heart is beating through that. Is that
Yes. That's the ECG. Yeah.
Mhm. And
And
then
then
if you see something there, doctor, like that's not normal, like a sudden drop or there's a pause, that also can that also indicate coronary artery disease or some other thing?
yeah, usually we have ST, what you call the ST segment. If it drops a bit, then more than 2 millimeters,
Mhm.
then it can signify ischemia or lack of blood supply to the heart.
Mhm.
And also, depending on the test, the more accurate ones will be the ones with imaging studies. So that's a
Mhm.
stress echo or a myocardial perfusion imaging. So when you
Okay.
have this test, the accuracy is around more than 90%.
Wow, what was the test again, doctor? Can you
Stress echo
stress echo and
or myocardial perfusion imaging.
myocardial
Fusion,
imaging? Okay,
perfusion.
perfusion
Uh,
imaging. All right, great to know. And then also, doctor, if it's a 2D echo, I'm just explaining to some of our, because they get so scared, they panic. You lie down there, they use like a kind of I guess like a sort of ultrasound type of thing, and they just put it around your heart, and then the imaging comes up. And what's the difference between a 2D echo and a 2D echo with color Doppler flow? Hello, doc.
the color is just the technique. So they every to the echo. Yeah. Hello?
Yes.
Yeah. So nowadays, every to the echo has a color flow Doppler.
Ah, okay.
The complete thing. We don't do to the echo alone without
Okay.
a Doppler.
So it's like an improvement in technology that has become standard already. Okay.
Yeah.
All right.
It's already standard.
Okay. Thank you, Doc. Okay. So can I ask you specifically about the relationship between diabetes and coronary heart disease? Because a lot of people will say, oh, automatically assume that if they have diabetes, there's something wrong with their heart also, or they have a condition with the heart. Or some people will just say, oh, my blood pressure's high, I probably have diabetes too. So that
Yeah.
we can get be misinformed. Okay.
Yeah, the diabetes is a major risk factor for coronary artery disease. In fact, it is considered what we call a coronary equivalent.
Mm.
So, what do I mean by that? Patients who have heart attack, a prior heart attack, have a higher risk for another heart attack. Okay? But when you have a diabetic patient, the risk of heart attack is similar to the one I previously mentioned.
Okay.
So that's why it's called a coronary equivalent. So
Coronary.
in fact, the life expectancy of diabetic patients are quite shorter because of the possible long-term complications if left untreated.
Okay. If left untreated, that's very important to remember. And of course, doctors like Dr. 𝗛𝗲𝗁 and other doctors in Makati Medical Center can help treat you. Okay, doctor, before we take a break, I'd like to go through the relationship of, good cholesterol, bad cholesterol, and whatever other undetermined cholesterol. When people see their blood tests results, let's say from the SPEC 23, there's HDL.
Yes,
LD.
that's the good cholesterol.
Okay, HDL is the good cholesterol. And as you said earlier, you can get that from fish or fish oil or
Yeah.
things. Okay. So can you eat the belly of the fish because it's fat?
Yes,
Would that be good?
that's good
Okay.
cholesterol.
Not the belly of a pig? Bad.
No, that's bad cholesterol.
No. Okay. So to remind people out there, HDL is the good cholesterol. LDL is the
Yes.
bad cholesterol. And LDL is the one that causes plaque.
Yeah, the atherosclerosis.
Okay.
And having a high HDL will somehow counter the bad effects of the LDL. So it's beneficial to have a high HDL.
Okay. Yes, because some people might just avoid all kinds of cholesterol, thinking that that's the way to go. But it's actually good where it's coming from, maybe what you can eat to raise your good cholesterol. So good cholesterol and bad cholesterol, actually, good cholesterol can control bad cholesterol. In a sense.
Yes, yeah, it acts as the scavenger of the bad cholesterol.
Okay. What do you mean? It eats up the bad cholesterol?
Yeah. So it minimizes the effects of the bad cholesterol. So efforts to increase your HDL is also important. It includes sometimes eating more fish or even taking some supplements like fish oil.
Fish oil, yes. And I remember when we were kids, they used to try to shove fish oil down our throats, and it was just disgusting at the time. But thank you for giving that to us. Doctor, what is VLDL? Everyone's like,
that's a very low density lipoprotein. So it's also part of the bad cholesterol.
Okay. So when your VLDL is high, you're like, that's part of the bad cholesterol also.
Yeah, only HDL is the good cholesterol.
Okay, so
the rest are bad, so it's easy to remember.
Okay, so there's one good guy, one protagonist, and two antagonists in our cholesterol profile. Okay, thank you, doctor. Doctor, we're just gonna take a short break. Folks, stay tuned. As you can see here, Dr. 𝗛𝗲𝗁 is very patient in asking all my questions. And if you have any questions, throw them in now while we're live on the show. Okay, we actually do have questions, doctor. So when we'll get back, we'll address some of those questions and we'll talk about how coronary artery disease is treated or managed. So guys, stay tuned. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗂𝗶𝘁𝗵𝗹. Available for outpatient care services, our 𝗂𝗶𝘁𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗂𝗶𝘁𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗂𝗶𝘁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝗁𝗶𝗵𝗂.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Okay, folks, we're back. It's we're somewhere in the middle of the show. We are talking about coronary artery disease, or CAD. With us is Dr. 𝗛𝗲𝗹𝗁𝗶, and he's very patient in answering all of my detailed questions. And I would assume that doctor, I think you'd be a great doctor to go to, because you would calm me down. And bedside manner is very, very important. Who knows, maybe if I could get your number later, I'd probably, check you out or recommend you to a bunch of people. I know you probably don't need more patients because you're a very busy guy, but if there are people who need your help, since you're a doctor, I'm sure you would somehow consider taking them on. Doctor, before I ask the rest of my questions, we got some text messages with some questions from viewers or listeners, and this is from Nikki Sarmiento of Rizal. I am experiencing. Okay, well, I guess.
Sorry, I think I didn't get that question.
Maybe, doctor, we would have to know your age, gender, and weight, Nikki. But does that play a role? I guess Nikki is asking.
Sorry, what's the question again? I think I missed that part.
All right. Am I experiencing heart-related symptoms because of my age, gender, or weight? I guess. We'd have to know that, but I guess to answer, Nikki, does it play a role? Age, gender, and weight?
I assume Nikki is a female. So if you're premenopause, your risk of having coronary artery disease is extremely low.
Okay.
So that gives you a protection, but after menopause, the risk starts getting higher.
All right.
So sometimes when you see patients with chest pain and etc., and that they're at the reproductive age, then the chance is very small. Compare that to with a male, we see a lot of them in their 30s and 40s having coronary artery disease.
Okay, doctor, why is that? Is that because of biology, or is it because of
it's hormone? The hormone protects the women during their reproductive age years.
Oh, is this the estrogen?
Could be, yeah.
Or basta some hormone. Okay, doctor. So when you're a female, your risk increases after menopause because you don't have those hormones anymore.
Yes. Yes. So before, if you have just discomfort, shortness of breathing, and you're in your 30s or early 40s, the chance of being a coronary artery problem is small. It's still possible, but the chance is quite small.
Okay. So and then when you're going through menopause, or you think you are, I guess, doctor, we should advise also the women to go to their OBGYNs, because sometimes you're premenopausal, but I was told before by an OBGYN that, well, I'm not menopausal yet, but I know a lot of people who are, that if you don't get your, hey, no judgment there, we're all gonna get there. That if you proper saying that you are in menopause, you don't get a year or for 12 months. You can't say, oh, I didn't get it this month and then I got it 3 months later. That's not yet actually menopause. That's
about, I think, 1 year without menstruation.
1 year without menstruation, then you can say you are menopausing. Before that, I guess it's perimenopause, or the prelude to the for a lot of women, your age, I guess, and your gender and your weight. If your weight is not, let's say, doctor, you're on the heavier side, but it doesn't mean unless you get it, we can't tell unless you get a test if your cholesterol is high.
Yes, correct. There are patients who are quite thin, and then their cholesterol is to the roof. And
Yeah.
then we get patients who are on the heavy side with normal cholesterol.
And even for
So the weight cannot be, you know, a way of telling cholesterol levels.
even even for the blood sugar, no, doctor. I mean, just because someone is on the heavier side, you don't automatically say this one has diabetes or
Yeah,
high
not
blood
that's
sugar.
not automatic. Of course, the risk is quite higher, but it's not automatic because we have diabetes who are on the not on the heavy side, who are not on the heavy side.
Okay. Thank you, doctor. Now we have another question here from Uncian of Cavite. Do men and women experience the same symptoms associated with heart disease?
Yeah, more or less they are similar, but you have chest discomfort, shortness of breathing, also palpitations. These are might more common in women though, the palpitations.
The palpitations. Oh,
Yeah.
do you know why that is, doctor? Or is it just something that we have a
Uh,
time?
I think it just so happened. I don't really know the exact reason why.
Yes, yes. Okay, thank you, doctor, for answering that question. And thank you, Uncian of Cavite. And then we have a question from Gina Sargon. Do younger, physically fit women need to worry about heart disease?
So I think it's best that they check also because even though your risk is still small, it's better to check for signs of high cholesterol. So if you're not going to take any medicine, at least you can already adjust your diet, do more physical activity, and diabetes can have its onset even before menopause. So if you're diabetic, and then you can start treatment early on.
Thank you, doctor. Probably, yeah, Gina. The thing would be to get regular checkups, even
Yeah,
just once a year, a blood
once a
test.
year if you're low risk, and then if there are findings that needs to be followed up, maybe every 3 to 4 months should do, and even every 6 months if it's not a complicated medical problem.
So for a younger person, doctor, just to add to Gina's inquiry, I guess, for a younger person who seems fit or who is fit, um, is it a good idea to get like once a year, even just a basic test, like your basic
Yes.
SPEC 23 plus
Yeah.
an X-ray of
Maybe an
the
ECG or X-ray. Yeah.
ECG, X-ray of the lungs and the heart, and the SPEC 23, and the
Yeah.
urinalysis and the stool fecal.
Yeah. The
Oh,
usual.
okay. Yeah, the usual, doctor. Okay. Okay. We have one more question from around, but thank you. Oh, hi, Nikki. No question, but because I'm also called Nikki by some people, like Nicole, Nikki, that kind of thing. Nick. Hi, Nikki. No question, but my sister is watching you in LA. We missed your show. Thank you, Christina. Okay. Oh, we have more questions here, doctor. Oh, this is from Carmen Kraus. Hi, Tita Carmen. Okay. Hi, Nick. Dr. De La Rosa is my doctor. Okay, so
Know
you've
her.
been outed as the doctor of Carmen Kraus. Hi, Tita, that's watching. I have not been to see him, though, since the pandemic. I have been remiss. Yes, Tita Carmen. Dr. De La Rosa, are you ready to see Carmen Kraus?
Sure.
Yes.
Anytime.
Okay, I know. And that happened also during the anytime. Okay. Doctor, I mean, that happened during the pandemic. And I have a note here in my questions. I was going to ask you, do you find that a lot of patients like couldn't go to you during the pandemic? And okay, Tita Carmen, not to scare you, but for some who have gone back to you after the pandemic, I mean, staying at home, did their condition get worse, or did it stay, and then some stay the same, or some may have even gotten better?
Some didn't do very well because they
Mhm.
didn't have a regular check, and some were not able to learn replenish their medications, and some became suddenly not able to move around because of the pandemic. But during the pandemic, we did some things to bridge the gaps, so to speak. So there was a time that we're doing more virtual consultations. So it removes the fear of getting infected by COVID during that time.
Yes, yes, I did do those teleconsultations, and for someone older, I'm actually the person who accompanies the person who's sick all the time. And some of those teleconsultations were very helpful because at least, you know, you could keep in touch with your doctor and say, hey, this has been your blood pressure, you know, still, you know, kind of maintain it. Okay, so Carmen Kraus,
See you with a clinic.
doctor, just please, thank you, Lee. Ano, okay, level of anxiety. Okay, sorry. So, if just in case you didn't hear me, we have a question from Eli Serrano. Is my level of stress and anxiety increasing my risk of heart complications?
The answer is yes. Stress can be a factor for increasing heart complications. Uh, it's how we react to the stress, actually. Stress will always be there. As long as we're alive, there'll be some form of stress somehow. But it's how we react to it. It's how we handle it that becomes a factor. So I usually tell my patients that if there's a problem that you can do something about, do something. But if a problem is there that whatever you do, it's just the same, then don't bother.
Thank you, doctor. So the way you treat people is also more holistic, and it comes in components of some psychology and spirituality. And I mean, you know, just plain common sense as well. My mother used to tell me when I was a kid that if there's a problem, find the solution. If there's no solution, then it's not a problem. I mean, it's a form of way of, hi, mom, by the way, mom is watching. Okay. Thanks for watching, mom. Okay. So anyway, okay. So, and it adds to it, doctor, can I get into so we have the component where it's how we deal with the stress. And we sometimes refer patients to psychiatrists or psychologists to help them deal with stress if they're overwhelmed.
If it's what I can do, then I refer them to the psychiatrist. Otherwise, I talk to them first and see how I can help them in my own little way.
I'm sure that helps a lot, doctor. I mean, it always helps to talk to your doctor, the one treating you, basically your healer. And also, doctor, can we get into the physical part a little bit? Okay, if we can manage our stress on that level where we don't let it bother us, but when it starts bothering us, physically, I know something happens to our bodies. Is it the rush of adrenaline? Is it like a cycle of too much adrenaline and we're always in fight or flight mode? Is that what causes?
Yeah, that could be a factor. And then sometimes we give some medications to make them a bit more relaxed. So as a backup, if we can't just convince them or just talk them out of the problem.
Yeah. Okay. Yes, that's also needed, doctor. And since of course you are doctors and you trained this way, I'd like to explain this to some people who keep asking questions, about why do I need this? Why did my doctor give me something to calm down? Well, also because you're doctors, you treat the body physically. You're there for us, I guess, psychologically, spiritually, socially, but you treat the physical and the biological aspect also, and first and foremost. So thank you for answering that question, doctor. And Eli Serrano, I hope your stress goes down or goes away, or whoever's stressing you just goes away. And one more question. Oh, no name, but there's a question. Okay, what are the treatment options for the heart symptoms? We'll get into that. Okay, stay tuned to the show and we'll get into that in a bit. And Jessa is asking, what are the modifiable risks of heart disease? Okay, we'll get into that in a bit. We're just going to take a short break and we'll be right back so we can talk about the last two questions that also coincide with the other questions about CAD or coronary heart disease. And doctor, hang in there. I'll be back with so many more questions, but you're used to me already. Okay. So stay tuned.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
World-class quality healthcare with a heart is now more accessible and affordable with Makati Med Care Access. I am Dr. J.A.C. from Makati Medical Center. Our mission is to serve and provide compassionate care and excellent service to everyone who needs it. And now, we are bringing our renowned brand of world-class healthcare to where you are. With Makati Med Care Access, we have expanded our services beyond the hospital premises to serve you in convenient locations where you can avail of premium but economical healthcare. The Makati Med Care Access Araneta City is where we offer health screening and diagnostic procedures. Here, you can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. What's more, Makati Med Care Access Araneta City is the only single-use hemodialysis center in Araneta City. This makes it easier and convenient for patients to avail of renal care services right in the heart of Cubao. Here at 𝗛𝗶𝗵𝗶, another Makati Med Care Access Clinic is located, offering outpatient care like consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby communities who do not want to proceed to the hospital to have these treatments and procedures done. The Makati Med Wellness Center, located at Ayala North Exchange, is a warm and comfortable space where executive checkups and services for holistic patient care and wellness can be availed of. In this wellness center, we have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. It is equipped with modern facilities and has competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services to adult and pediatric patients alike. It is connected to the main hospital by a bridgeway at the side of Ayala North Exchange. To make our services more accessible to certain areas, the Makati Med Mobile Care Access was launched. As the name suggests, this service is mobile. We go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on what your community needs. We can go to any location of your choice within the metro and conveniently offer healthcare services to fit the needs of any community or group. For added convenience, different modes of payment are available, inclusive of HMO benefits for those with a valid letter of authorization. Now that is truly accessible healthcare. All these additional locations under Makati Med Care Access are meant to make it easier for more people to avail of our services. After all, access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For your healthcare needs, please visit us at the following Makati Med Care Access Centers or contact us to come to you and allow us to take care of you.
You're back with Healthline. keeping you healthy. Moderated by Nicole Jacinto.
Yes, folks, we're back with another great episode of Healthline with Makati Med. I am thoroughly enjoying my guest, Dr. 𝗛𝗲𝗹𝘁𝗵. He is a cardiology specialist, and we're talking about coronary heart disease, or CAD. And again, Carmen Kraus, just stay tuned and keep watching, and Dr. 𝗛𝗲𝗹𝗁 is waiting for you. Okay, doctor, so earlier we had a question from No Name, which is, what are the treatment options for the heart symptoms? However, I would like to ask you a more specific question, which may help answer this, No Name. How do you treat coronary heart disease? Okay, once it's discovered, how do you treat it? I mean, of course, there are medicines. Are they temporary? Are they permanent? I mean, other ways. How do you usually treat it?
We use what we call a blood thinner. We give antiplatelet agents like aspirin, clopidogrel, or ticagrelor. And then for some patients who might not do well with medicines alone, then there are procedures that can be done to revascularize the blocked arteries. And that would include angiogram with possible angioplasty, or in rare cases, bypass. So unlike before that we do more bypass cases, right now it's more of the angioplasty, even for the more complicated cases, because of the advancement in technology and expertise.
Okay. So doctor, when you say that some patients don't do well in medication, do you mean that their disease, their CAD doesn't improve, or it's not controlled?
Yeah. So in some patients, we catch them with already severe problems. So these are the patients that will need the angiogram and revascularization with either angioplasty or bypass. But these patients will also need medications.
Yes. So
these treatment are on top of this. Yeah.
Okay. So doctor, the medicines that we talk about, because a lot of people would ask this, are they temporary or are they maintenance medicines? Is it a case-to-case basis?
More often than that, these are maintenance medicines. For example, if you have hypertension, these are usually maintenance medicines. For diabetes, the medicines can change from time to time depending on the situation, but these are more often than not maintenance medicine. And also for cholesterol. So when we give statins, usually these are maintenance medicine, and we just adjust accordingly. But the control of all these risk factors are very important in lowering the risk for progression of the coronary artery disease. For example, when we give statins in those with high cholesterol, we lower the risk of heart attack and stroke by around more than 40%. So that's quite significant.
Yes, it is, doctor. Okay, so blood thinners, clopidogrel, I know people who take that. Like some of them are required to take it every day. And the others, after an incident, it's like 3 times a week. Of course, they have other medications too. So that's just remind the patients there that your doctor may say, I mean, go for checkups, because when we went for the checkup with this particular person, they didn't. The doctor decided you don't have to take it every day anymore. No, just 3 times a week. I don't know, maybe so that you don't get anemic or your blood clots, whatever the reason is, the doctor will explain it to you. But they have a lot of questions. Why not every day? Why not this? So, and I have a lot of questions too. But okay, so the doctor or team of doctors will manage it. We mentioned statins. There is a big, well, in some people I know do not want to take statins. They say it's bad for you. But you did mention that the risk of getting a heart attack or stroke is lowered by 40%.
By more than 40%.
More than 40%. Why was, in your opinion, or based on your knowledge, why was there a controversy about statins being bad for people? And I know people who have taken statins for, let's say, 30 days or up to 3 months and then stopped. What can you say about that?
That's statins for high cholesterol, especially for secondary prevention, are maintenance medicine. So we adjust accordingly depending on the side effects, if any. So the side effects are quite rare. Some patients will have muscle pain, so we just have to adjust the dose. or sometimes their liver function gets up a little bit, so we just make some adjustments. But
Yeah.
these are basically maintenance medicine.
So basically, if they're, let's say they notice their liver function goes up, and you can adjust it. You can lower the dosage or talk to the patient and work it
Correct.
out. I mean, if someone takes statins for 3 months and then said, "Oh, my cholesterol went down," and then they stopped, it
And then
is,
they forget about it, and then they don't know that their cholesterol is up again until they have another checkup, maybe in 9 months or a year. So
and
basically, their cholesterol is normal for 3 months only.
or they will insist that I can do it with diet and exercise, even though the doctor has said you must take statins or it is better for you to take statins. So do you encounter patients like that?
Yeah, yeah. So some of them, of course, understandably, they want to take medicines. That's understandable. But there are situations where we really need to take those medicines and just make the adjustments. So I sometimes tell them, show me the numbers. So if
Yeah.
you don't want, because initially, if there's the risk factor is not that much, then we try to do dietary and lifestyle changes and let them come back, and if they show me really good results, then I'll go with what they want.
Okay, great, doctor. So see, I knew it. You'd be someone who would really be attentive to the patient and deal with individuals as individuals. Okay, doctor, I have a bunch of questions for you right now. Um, when okay,
It's okay. Go ahead.
so we're told that cholesterol, once we have it in our bodies, we can't really remove it. I was told that oatmeal is one of the few things that can remove cholesterol because it binds in your digestive system with whatever whatever cholesterol that is, and takes it out. Is that correct? Is that fact or fiction?
Yeah, the use of eating oatmeal is actually good for our health, no? So it binds the cholesterol. So basically, some of it will just go out.
Okay.
Uh, so that's quite beneficial for us.
Okay. Okay, so is it fact or fiction? Once cholesterol's in your body and around your arteries and all that, you cannot take it out anymore.
Yeah, some of these get deposited in the what we call our blood vessels. Some goes to the liver. We have fatty liver. When we take these statins, what happens is that we stabilize these cholesterol plaques, and when there's less plaque rupture, then we have less cardiovascular events.
Okay, but the cholesterol is still within the body. It's just being
Yeah.
controlled. Okay, so doctor, okay, indulge me. Can you remove cholesterol blockages? Let's say like um that. Okay, there are blockages that absolutely need to be treated, like what you said earlier. Procedures like angiogram, angioplasty, and then coronary bypass. And as you said, bypass is being used less and less because of the advent of technology with angioplasty and angiogram. Okay, first, doctor, can you tell us the difference between an angiogram and an angioplasty?
Angiogram is just the diagnostic procedure. It's not a treatment in itself. So it's like trying to know whether there's a block or not. And then the angioplasty is a therapeutic procedure where we open the blocked areas of the coronary arteries.
Okay, so doctor, it happens that when you start, okay, so first an angiogram or angioplasty, you make a small hole in the let's say the thigh area usually, or it depends. Like
Before it was what we call the femoral access, so it's near the inguinal area.
Okay.
And now, more often than not, the radial access. No, the radial access is used. So it's through the radial artery in the arm.
Okay, so you can do it now through the arm. That's great. Arm, arm or groin. Take your
more often than not, it's through the arm already. The
arm
radial
already,
artery.
and
Yeah.
it's closer to the heart, no? So
Yeah. Well, it's the access is it's smaller. The radial artery is smaller, but you don't have to have compression after the procedure for a long time.
Okay, sige. Okay, so doctor, okay. Can doing an angiogram, do you get ready to already do an angioplasty if you see, hey, there's this black?
Yes. Yeah.
Oh, yes. Okay.
So it's usually a double set. So once we get the results right away, this is being discussed with the patient and their family. And if there's a block, then we proceed right away to the angioplasty.
Doctor, are patients awake during the procedure? What's it like?
Yeah, they're sedated. They're sedated, but they're awake, and you can even talk to them during the procedure.
Sounds like me when I'm sleeping. I talk in my sleep. Okay, you can talk to them, and through the both the angioplasty and the angioplasty and the angiogram, patients are awake. Okay, and they're sedated, and you can talk to them. And you know, if you're like me, I like looking on the screen when they're doing my stomach, and then they tell me go back to sleep. You know, so okay, so just indulge me. Is there a way that you can take out, take out plaque, even if it's not absolutely necessary yet? Like, let's say you do an angioplasty and then you say, you know what, I'm just going to scrape this to make it clean for the future. Is that, I mean, theoretically possible? Is that put to practice? Like, kind of like a plumber cleaning out the pipes already.
Yeah.
Mhm.
So there are some procedures where we call they do atherectomy, but it's not often used. More often than not, we just do angioplasty, and the medications are being given also help control these plaque deposits in our
Okay.
coronary arteries and in the different areas of the body
Okay.
where we have blood vessels.
Yeah. Because I was wondering if you could, stick a bunch of, theoretically, maybe technology will get like that one day where you could stick in a bunch of tubes and then just clean out all the plaque from all the arteries. just a thought. So
The best way really to go about is to prevent it from happening.
Okay. Thank you, doctor. Okay. I just had to ask that. Okay. So there's no procedure yet that essentially cleanses all the arteries, like a plumber or, or cleanses the blood. This is the way it's usually prevention or management or treatment through this
Actually,
way.
the current medications we use, like the antihypertensive medicines, the anti-diabetic medicines, and even these anti-cholesterol medicine functions like that.
Okay.
So you already do it without doing it physically.
Okay, so no need to go in and scrape everything. Okay.
You cannot do that.
Thank you, doctor. Okay, thank you for indulging me with that question. I do have one more question. If somebody say if somebody has an abdominal aortic aneurysm, is it considered related to or part of coronary heart disease? Heart disease, sorry.
No, it's a vascular. Yeah, it's a vascular problem, but the abdominal aorta is a bigger artery in the abdomen. So it comes from the aorta coming from the heart and going down to the abdomen. The coronary arteries are a lot smaller and they're nestled on top of the heart.
Would a procedure like an angioplasty or an angiogram or other like more non-invasive procedures also be able to let's say address
Yeah. There are ways right now to handle that with our vascular specialists, wherein they do it's like putting some stents there
yes.
to treat aneurysms. So this is now available with us. Not that commonly done because also the costs involved. It's quite expensive, but it can be done.
Okay.
So there's the option of doing surgery and our vascular specialists are also can do all the other procedures
But
without
the less
surgery.
invasive procedure is less risky as opposed to open surgery.
Yes, yes. So
Thank
that's
you.
the reason why there's a move towards that direction.
Okay. Thank you, doctor. Okay. Um, we're just gonna take a short break, and then when we get back, we're gonna talk about, what happens if CAD is left untreated, and then we can go back to the question of Jessa, which doctor mentioned before, talking about modifiable and non-modifiable. I think he's already mentioned some of those things, but we're gonna get down to what happens when it's left untreated, what are the major risk factors, and we can towards the end we can talk about lifestyle and get into that more, because as doctor has already stated, lifestyle, as we just broadly call it, or your diet and whatever you do, greatly affects this illness, which is coronary artery disease, or CAD. Doctor, hang in there. Thank you for answering all of my questions. Guys, stay tuned, there's more to come.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Indeed, you're back with Healthline with Makati Med. I'm your host, Nicole Jacinto. We are live on DZRJ 810 AM Radio Bandido. We are also live on DZRJ 810 AM Radio Bandido TV. We're on Facebook. We're on YouTube. You can come and find us, and you can view the show as many times as you want to hear the very detailed, factual, and intelligent answers of Dr. 𝗛𝗏 today as we discuss coronary heart disease. Okay, Doc, let's get back to coronary artery. I don't know why art is always in my head, no? Coronary artery disease, or CAD. Now, what happens when CAD is left untreated, doctor? Can it just stall on its own or level off, or will it definitely progress?
When left untreated, you can have an acute heart attack, and then some patients will develop heart failure. Some patients will develop arrhythmia, and worse, patients can die.
Okay, so you mentioned some of the things that can happen. So it definitely will progress if you leave it untreated. Like, okay lang yan. Ganun lang. Okay. So, so you mentioned some of the things that can happen: heart arrhythmia, heart failure. Some patients can die. What are all the other illnesses that someone can get, if you know of any more, from not addressing, not addressing the issue, or leaving CAD untreated?
Okay, for those who develop, for example, heart failure, then they can have limitations in their daily activities. They get tired easily. They are unable to do what they usually do. then that becomes a problem. For those who develop arrhythmia, some of these arrhythmias can be fatal. Sometimes the heart can stop suddenly. So better really to address these problems while it is at the early stage.
Okay. At the early stage and whatever stage you're in, just, address it with a doctor. Don't put it off. And then, doctor, can you tell us what the major risk factors are, that you find in patients who have developed coronary artery disease or CAD?
Yeah, as I mentioned, there are two, the modifiable and unmodifiable. So let's just focus on the
Okay.
modifiable because there is something we can do about it.
Yes.
It's important to highlight that lifestyle is really important. So, for example, the diet that we eat on a regular basis. So we try to avoid the fatty foods, more fish, vegetables, and fruits. We quit smoking or even vaping. We do regular exercise. Just 2 months ago in Europe, there was a study that was published with more than 250,000 patients wherein they saw that for non-seniors, if you walk 7 to 13,000 steps every day, it translates to around 49% reduction in death. And for the seniors, they can just walk 6 to 10,000 steps per day, and the reduction is 42%. So all these basic things, including avoidance of excessive alcohol and learning to manage stress, will also make a big factor. Aside, of course, from the usual risk factor that we know, like hypertension, diabetes, and high cholesterol.
Thank you, doctor. Okay. I go through that a little bit one by one. Okay. Okay. Why smoking? What does smoking do to the body that elevates
Yeah,
the...
yeah, it destroys the what we call the surface of the blood vessels, so it makes them prone to injury and eventually thrombus formation, eventually heart attack. Aside from that, the risk for malignancy is also higher in patients who smoke. Lung cancer and even other cancers aside from the lungs, the
And
risk
also,
is higher.
sorry to interrupt you. Also, you mentioned vaping because a lot of kids vape these days, but if they inhale, we don't know what they're in.
It's also not healthy. Vaping is also not healthy. So some people might think that I don't smoke anymore, I'll just vape. It's also not healthy, so best to avoid.
But I guess my opinion about vape, I'll just share my opinion, doctor. And you, of course, you gave yours already, which is the official opinion here. Because I know some people who vape, but I'm telling them, like, if you're inhaling, that's like water in your lungs. So I think I'd rather smoke a cigarette. I mean, because I don't know what happens, with the lung damage. If there's like liquid in your lungs, I feel like it's worse and it can happen immediately. But sige, I'll take that debate up privately with the people I know who some of them may be watching this show. Okay. And then, doctor, when it comes to, okay, diet, no? Why alcohol? Why not excessive alcohol?
Yeah, excessive alcohol is toxic to the body. Sometimes we see patients with what we call alcoholic cardiomyopathy, wherein the muscles gets weak because of too much alcohol. So a simple analogy is that if you take alcohol, say a bit, almost every day, then that will be okay. But if you don't drink alcohol on weekdays, but on weekends, you binge with like 7 or 10 bottles of beer, then that's not healthy.
Yes,
Because
yes.
it takes time for the alcohol to get out of the body, and if it remains there for some time, that's why we have what we call a hangover. Then it's toxic to the body and especially to the heart, because you can have heart failure.
Thank you, doctor, for going through that and explaining. Some people say, well, I just have a glass or two of wine a day, but it goes more to like 3 or 4, and that's almost a whole bottle already. And as you said, if you does it depend on the type of alcohol also, or just any alcohol in general?
It also depends. Also depends on the type. Of course, if you're talking about hard drinks like whiskey, then you can't take as much because the alcohol content is higher also.
So if it's wine or beer, because some people will say this, then
Wine or beer, wine maybe 1 or 2 glasses will be okay. Beer, maybe a bottle of beer is okay.
yeah.
But remember, these are also calories with it.
Yes, I mean, you're gonna get fat, and then you're gonna get hungry and eat more. So, and then you'll have like less inhibitions and crave stuff. I'm talking to someone specifically who's watching this. Okay, so anyway, it's not like I'm an alcohol police. I'm just explaining things.
The rule of thumb is if you want to lose weight, is you eat your calories. You don't drink it.
Okay, great, doctor.
So
And
you
then,
avoid the sugary drinks because it's full of calories and it can make you gain weight.
I'm guilty of that. The sugary drinks, the sodas. And doctor, also, I'm very happy that you mentioned that. Yeah, if you don't drink during the week, but you binge on the weekends, that's really bad. And I mean, you can also, like, if you're, for some reason, you're not in control of it. I mean, there's many things you can black out with alcohol. You can get alcohol poisoning, all of these things. Like you said, your heart can stop. Okay, so we've talked about alcohol, why we should control it, the intake, smoking, that it destroys or damages blood vessels, and correct me anytime, doctor, if I'm wrong. When it comes to the diet, doctor, okay, what should we really be eating? You said vegetables?
Yeah, more vegetables, more fruits,
Fruits also.
fish. Yeah. What's one important thing to know about diet is the calories. So there's a basic rule that in anything, like for example in diet or even business, what is not measured is not well counted. What no what Let me rephrase that. What is not measured is not well managed. So you
Okay.
have to measure your calories, and if you cannot do it, there are other options where you can have food delivered after to you if you like to go to that extent. So you can manage the calories that you take. No, so for most of us, including me, it's hard to really count the calories on my own. So if you have a provider that can already give you, like for example, 1,500 calories per day, and then you just eat what is given to you, then that's one way of losing weight.
Okay.
And there's corollary to that saying. They say that what is measured gets done.
What is measured gets
So
done.
that's not my own statement. I got it from somewhere else. But I think it's applicable to the diet.
Yes, doctor. I agree with you. And then earlier you mentioned that they did a study in Europe. 250,000 people participated. For younger people, taking I'm sorry, up to 20,000. It's right here. 7 to 13,000 steps a day.
For non-seniors, yeah, for non-seniors, 7 to 13,000
And then for
steps per day. So if you have your phone, whether it's Apple or Android, there's a way of measuring your steps as long as you have your phone inside your pocket.
And then for seniors, doctor, my concern is this. What if they cannot be mobile because of an injury, or they can't walk as much? How do you address that if you can't take as many steps?
Yeah, there are other ways. For example, those who have knee problem, of course, swimming is one of them, or maybe exercises that are not too strenuous to the joints, like for example, elliptical. Or sometimes you can just exercise your upper extremities. So there are a lot of other ways to do it.
And you can consult with maybe a physical therapist with
Physical,
that.
yeah, physical therapist, cardiac rehab doctor,
And
or
perhaps,
even the rehab doctor, not necessarily a cardiac rehab doctor, can
and
handle that.
perhaps this is when the nutritionist comes in to help with
Yeah,
that.
yeah, because as I mentioned earlier, what is measured is well managed.
Doctor, okay. So we are running out of time, and you have the floor. What advice do you have for patients who have coronary artery disease, or who are being treated for it, who are managing it, and how should they manage it on their own? Just anything you'd like to say to them, or any encouragement. Please go
Okay.
ahead.
as they say, an ounce of prevention is a pound of cure. So we want you to be able to control your risk factors, be it hypertension, diabetes, and cholesterol. And remember, there are lifestyle changes that you can do. A simple walking, can reduce your risk for dying. The diet that you do by measuring your calories, by quitting smoking or vaping, by not drinking too much alcohol. We have only one life to live, so control your risk factors so you can have longer and quality life. That's all.
Thank you, doctor. And doctors like you from Makati Med can help us do that. Dr. De La Rosa, thank you so much for agreeing to be on the show again and for reminding us about the coronary artery disease and going through all of the information that we need to know. And thank you for answering all my crazy questions. You're used to me already, though. And to Miss Carmen Kraus, Dr. De La Rosa is waiting for you. Doctor, hope to see you again in person soon, not because of illness.
Hope to see you.
Okay, thank you very much.
Thank you for inviting.
Of course. Okay, so folks, next week, 5 p.m. to 6:30 p.m., Healthline with Makati Med will be back. And doctor, thank you for being my guest today. Bye, folks. We'll see you next time.
Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.